everyone. My name is Amy Hetherington. I'd like to welcome you to our November broadcast of Talk, Listen, Share. As you recall, this is part of our wonderful programming with Shay's Warriors, which is an organization that helps to promote the survivor of cancer's experience and to give them a space to talk about their experience and to continue to feel empowered, to ask questions, to share, to connect, and to heal. So today, joining me for this program are Herb Dinwiddie, who is a survivor of cancer and also a caregiver, and David Reed. David is also a cancer survivor. And then we have Mr. Victor Lamke, who is one of our board member emeritus of the Shay's Warriors organization. So welcome to all of you.
Thank you. Thank you.
Just to kind of give some background as to what we're doing today with our discussion, what our topic is before we start to really get into some of our questions and our sharing part. I wanted to just remind everyone that this month's topic is with a focus on men's health, prostate cancer, side effects, and the cancer survivor and caregiver's experience. And the reason we're doing this for the month of November is because November, as some of you may be aware, is also referred to as Movember. It is now known as a month for creating awareness for men's health, but specifically prostate and testicular cancer, also mental health and suicide awareness, and basically to encourage men to talk about their health and to be able to have those open discussions with their providers and with their community as needed. Okay, so another important thing to mention is that, I don't know if you knew this, but on November 19th, it's International Men's Day. And so that's the day that we are broadcasting. Isn't that kind of cool? How it all just kind of came together like that. So I think that our topic today is really wonderful in that we're going to hit on all three of those key points of Movember by whatever you're willing to share with us today. So I think I'm going to ask Mr. Lamke, if you don't mind, to maybe give Herb one of our wonderful questions so we can open up our discussion.
You want me to ask the questions?
Sure. Yes. We can start that way. That's okay. Yeah. Any of us can ask a question.
Why don't you?
Okay. So what I'm going to do, I'm going to ask, firstly, I wanted to get a little bit into your experience, or as do you prefer to start talking more from the perspective of a cancer survivor or as a cancer caregiver?
Cancer survivor first.
Okay, that sounds wonderful. So how are you doing today after tell us a little bit about your journey and how you're feeling today and what your experience was with cancer.
Yes, in 2022 and 21, actually, it was like the COVID had started, and my doctor, my urologist said, yes, it's time to go for external beam radiation to your prostate. So they started it. It was a 8-week treatment. I was going to Eisenhower every day for 8 weeks.
Wow.
And, Eisenhower has perfected it very well in that they can pinpoint the exact cells the cancer is. Fortunately, the cancer had not spread any further than the prostate itself. So they were able to go in with pinpoint accuracy every day to get rid of some of the cancer cells. Yeah. And they also put up a shield at my rear end to protect the bladder and the other my anus and all that.
Yeah.
So that was kind of an ordeal. I didn't like that. That was very uncomfortable, but it dissolves after a while, so it's nothing they had to take out.
Okay.
So other than that, I'm doing well now because I'm in a much different place than I was at that time. My husband was going through chemotherapy. He died of stage 4 pancreatic cancer. The doctor set us down at Eisenhower and says, because at stage 4, you're not going to get out of this. You're going to be dead within 2 years.
Oh my goodness.
He lived a year and 4 months. And so I was the caregiver as well as I was taking care of myself. So that's my story up to that point.
Well,
Okay.
there's a lot to get into with this story.
It is, yes. And, I'm an old man. I'm 87 years old.
Wow. You know what? What do they say? Age is a state of mind. That's not entirely true. It is a biological fact, but we are as youthful and as the age that we feel we need to be and we can be.
I want to interject something here because I always say I'm not old. I've just been young for a lot of years.
There you go. I love that. That's
And
wonderful perspective.
It works. It definitely works. And it's true.
Yeah. Yeah. So
Do you have another question you can throw at me?
well, oh yeah. I mean, just based off of that, what do you think was the most significant way your life changed since you had that diagnosis?
My whole perspective of life was completely turned around. I collected automobiles and really enjoyed that. But when this happened to me, it was I wasn't interested in that anymore. I was only interested in taking care of somebody or giving advice or comfort to the people that were going through the same thing that I had gone through. So I've always been an optimistic person, and so I try to be as optimistic as I can, help other people that are on the same journey that I was on.
Yeah, that's wonderful. That must be hard though to always be the one helping others. I'm a nurse by profession. I'm a nurse practitioner. I'm also a nurse educator. But as a nurse in my profession, I know from what I do that there are times where there is kind of an altruism that's associated with being a nurse. And I think whenever you want to help others, it can become a bit of a strain, especially as you're going through something difficult. But how were you able to kind of flip that narrative a bit and not only be a person going through the experience, but also helping others? In what way were you able to provide support?
Yes. After my husband died, I went to grief counseling, 4 different ones, and a lot of the people were really down, very depressed. And, I always gave them, it gets better with time. And it certainly did for me. After 3 or 4 years now, I'm completely different than I was back then. I care about giving love and support to people, and it's probably because of my, I'm a retired physical therapist.
Oh, wow.
I graduated from Loma Linda University. I worked for the state of California for a while, but I always knew that I had something in me that I could give to somebody else that would cheer them up and help them. So that was my life work, just like being a nurse that you are.
Oh, yeah. that's, being able to fill your own cup and then fill others' cup is something that I think is a unique trait for a lot of individuals, but definitely for those that serve in the healthcare provider role. So you'd mentioned in what you were just discussing, you mentioned that you were in bereavement therapy.
Yes.
Okay, so
I went to 4 different ones. Yes.
Okay, why were there 4 different groups that were different?
Yeah, they were all different.
And so, okay, so tell us a bit about that. Why would you go through different ones?
Well, the first one I went to was at the center, the Gay Center in Palm Springs. That is, once they have 12 people, it's closed, and it's for 8 weeks. And so I was going 8 weeks. We were sharing about the loss that we had, everything that goes along with loss of a loved one. Then I went to the Mizell Center, which has one that you can go in and out of any time. I used to go to that one quite often and also drive someone there that wasn't able to get there on their own. So I would drive them there, and I did that one. Then I went to Eisenhower. I was the only guy there. The rest of them were all women, and we had all lost our husbands. And so at the end, we were all good friends. But at the beginning, they kind of looked at me kind of funny. What? You lost a husband?
Oh, well, we want to change all of that, right? We need to be providing support for everybody.
Yeah, right.
For everyone. And I think I commend you for going and doing that and getting help and being open to that experience. That maybe might have been a bit uncomfortable at first, because as you said, you became great friends.
Yeah.
But that takes time, and yeah, the discomfort sometimes can be something that makes some people want to just shut down and not continue to seek that connection. So, I think with our YoBro programs, this is really going to be expanding our ability to help men in our community feel more comfortable. I think what we're doing right now, or with sharing, is really, really, really impactful, and will help us.
Yes, it's know that you're not the only one. There are others that are going through the same experience that you're going through.
Yeah.
And that's why Bros is very good. I like it. I like their meetings they have basically once a month.
That's awesome. So what has been the value of, I know within YoBro, they do what they call guy talk, right? That's what we call it, guy talk. So what you kind of touched on it right there, that you really enjoy going to YoBro. How is it different what you talk about?
Well, we have a commonality because we've gone through cancer treatment, and and we all have all of us males have a prostate, and so we talk about that and what's going on, how we feel now. That it's just a good thing to have.
Yeah. Now, switching over to more of the actual topic of prostate cancer and that screening process, were you experiencing, and please, if it's something that's too, that you don't feel like you would like to share, that's okay. Were you experiencing symptoms, or was it just a routine screening, a men's health screening, where where you were noted to have something wrong with the prostate? How did that come about?
Okay, first of all, I went to my doctor. I'm tested every few months for my level 8 for the prostate level.
PSA.
The PSA test, and mine was up to 9. Normally, they like to have it like maybe 1, 2, or 3. but it had climbed up to the 9. And so my doctor said, I want you to go to the urologist and be checked out. So I was there at the urologist. They checked me all out, did all kinds of tests on me. And they just found out that it was only located at the prostate area itself. So then they did the external beam radiation for 8 weeks, and it was very good. I feel good now. I feel better now than I ever had, actually.
Good. So that brings me to the question that, again, I'm nosy, and I think that this is a good opportunity if you're willing to share. I would like to know if how cancer has really affected your relationships and intimacy. And
well, my husband, since he was, he was just really getting chemo just almost every day at Eisenhower. And he couldn't drive anymore. He had neuropathy in his legs. I had to drive him everywhere he went. So we were both going through quite a process at the same time. What was the other question?
So for intimacy and sexual health, having prostate cancer and going through treatment, has it changed? And if so, how? And
up to the present time too, because
well,
talking about initially, but up to the present time.
So as far as intimacy, yes, we always slept together. It was intimacy that way, but there was no sexual relations because this just wouldn't happen. So now the reason I feel so good is because my PSA level was down to 0 for like 2 or 3 years.
Okay.
And my doctor, so my doctor said to me, I think your life should improve better if we give you some Cialis and some testosterone.
Mm-hmm.
That's what I'm on now. So I take a 20 milligram Cialis every morning. I take the hormones, testosterone. It comes in a pump, and I pump it onto my chest every morning and rub it all around with a Q-tip, getting all over, and then it dries in a certain period of time, and I'm good to go for the rest of the day.
So you had a prostatectomy. Did they remove all of your prostate?
No,
and then they did radiation?
There was nothing that was removed.
Okay.
So there was no surgery, nothing removed. And it was all done. But when they talk about external beam radiation, it means that they're pinpointing only these cells that are affected, and they obliterate those cells. So there's no surgery involved, and that's what I wanted. I didn't want anything removed. I want to keep everything I've got.
Yeah, absolutely. And the nerves.
And the
that's the biggest thing, is the nerve sparing that can really be what, if nerves are severed, they don't necessarily reconnect. So as just for basic physiology for everyone, we need to have blood flow in order to have an erection. So that's a big part of that. And so if there's been any nerves that are impacting that blood flow and even sensation, then intimate sexual health is going to be different for that individual.
After my treatment and 0 PSA, my penis was only an inch long. Now it's full size. So I can perform any way I want now.
Fantastic. Well, that's something too that's another thing that I've heard from patients and from just overall from cancer survivors, prostate cancer, who've got just radiation for nerve sparing, is they can have an erection, but maybe it's not as firm. And so I think just that what you just described, having that combination of different therapies, is maybe the answer for some individuals.
Yeah, right. But my erections are very firm now, so I have no problem. The only thing that I would say is there is a little bit of less feeling
Sensation. Okay.
in my rectum because they had to put a shield up there, and I think, and it was put in slightly crooked to one side, which they shouldn't have done, but they told me that it was okay, that they could work around it. So that's basically it.
My goodness, as a survivor, I can't imagine just the strength it took to go day to day during those weeks of radiation therapy to willingly be placed in that positioning. Is so, sounds just so I don't even know what word. Is there a word that comes to your mind, Victor? I just
all I can say is obviously I know her for a very, very long time. Very long time. He mentioned that he had an interest in cars, and anyone who knows me, take a look.
Yeah.
I still maintain that interest, but I've known her for a long time, and he is just an incredible human being. I mean, you talk about survivor. You know, if you don't mind, I'll speak a little bit for you.
Please, let's talk him up.
Because he said he was going to all of these grief sessions and whatever. And yes, he was going. But part of going there was to offer inspiration and hope to the group, but not only the group as individuals. Do you mind me talking? I won't. Like, he would go up to somebody and say, "Well, you've been very interesting. Let's have coffee tomorrow." And he would engage and start to maintain friendships with people with the idea that, you know, I've been through some things. I know you've been through some things, and I want to work with you. I want to help with you.
Yeah.
As recent as there's a group called the Prime Timers, and they started Grief Session 2. And he mentioned the other day that he went to Prime Timers. They had their own grief session, and he had met somebody who was really suffering tremendously from the loss of also a husband. And Herb took him on and took him to coffee and to help him with the idea of, you know, giving out. So I'm in awe of him. I'm inspired by him every day.
Yes, and we are the best of friends. We go out for dinner together or lunch. We see each other at least once a week just to see how you're doing, that sort of thing. So I wish I had someone like that at the beginning of my being.
Yeah. It's important to be able to talk, just like talk, listen, share. I think sometimes from what I'm not a cancer survivor myself. I have been a caregiver for others with cancer. And something I've noticed, a lot of those who are undergoing cancer treatment actively, it's very hard for them to compartmentalize certain aspects of their treatment. And so what happens sometimes is whenever we're in a session or there's a session, it just is very, it's hard for them to listen. They just need to talk.
Right.
And it just starts coming out. So the listen part, I think, is very in connection with others, being able to listen to other stories and kind of share war wounds, but also how we are able to, go through a grueling experience and be able to inspire and find hope. and provide others with that hope as well. So that's such a gift. Not everyone is able to do that, but I'm so happy that you've been able to share some of your journey with us today. This is great.
It's important for all of us to verbalize what's happening to us and what we're going through. And it's comforting when you hear your own story being told about how, just talking about it brings comfort to you as well as other people.
Yeah, absolutely.
That's a good point. I think that's kind of the real important part of Yo Bro. It's actually the Yo Bro I Am Brave Too experience, because Shay's Warriors has provided that for men, more recent. And it sounds simple, you get together and you talk. It's more than that. You meet other folks and you exchange ideas and you hear some of the positive stories like her as detailed. And this Yo Bro is growing, and I think it's fantastic that Shay's Warriors has taken that on as well.
Yes. What message of, I feel like you're giving us a lot today, Herb, but what message of hope or unity would you like to share with other, as a caregiver now, as you cared for your husband? What message of hope or unity would you like to share with other caregivers or families facing cancer?
Oh, well, that's a good question. There was really no hope with stage 4 pancreatic cancer, and he went on hospice for 1 month, and then after that, he passed away. What's the other question? Ask me the second part of the question.
So hope is difficult, but unity, how were you able to, it sounds like hope I think was encapsulated in from what I'm hearing in your experience and the actual
yes,
surviving cancer.
Hope is one thing that all of us need. And as time goes on, time heals. And, I feel better now in my life than I ever have been before. So I have no aches and pains in my body. I feel like a teenager again.
It's that testosterone, huh?
The testosterone.
I would like to join that club. So can I sign up for that club?
I know.
Too?
I'm like, now I just kind of want to bathe in it or something.
Well, it's a controlled substance, so ask your doctor.
Of course, I know. We're not giving any medical advice here. We're just sharing experience, and thank you for sharing that with us. I think just talking about the positioning during your treatment, getting through that, the day-to-day, understanding, that you needed to go and seek support and taking those steps to do so, going to the different types of group therapy sessions, and kind of finding your people in your village and your community, or different levels of community at different times of your journey. Sounds like it was important for you. And then also sprinkling in your ability to provide others with your unique caregiving skills at the same time experiencing cancer is like, wow. But, I think for the biggest takeaway that I'm getting from you, Herb, is gratitude.
I'm grateful every day when I wake up. I said, I have a new day. I'm here. I'm still here.
Yeah.
So
that's everything.
Gratitude is one of my favorite words.
Yeah, for sure. So, Victor, your mic is, there you go. I did mention earlier, we started our show with David Reed, and unfortunately David's internet is not working as well today. So he does apologize for not being able to rejoin our discussion, but he he has wonderful advice and stories to share as well. So maybe on a different opportunity, we might be able to have him come share with us on another TLS.
He's an amazing person as well, who's been through a lot. He's come through, fairly strong. I want to point out, you talked about, what it's like. I'm like you, I haven't gone through cancer, but I've been a caregiver.
Yeah.
Two important people, my sister for one and my husband for another. And during the time you're going through it, it's a lot more difficult than after the time when you start coming out. For me, being the caregiver for Hector was, I was going to use the word torturous, but it was very, very difficult. And being a person who doesn't share that easily with other people, and not having too many people around other than, friends. Mm-hmm. Before that, my sister was really by my side, holding hands and whatever, and then she passed away herself at 15. So the going through part is hard. The only suggestion I would say is open up a little more than I did. But the post is where, all of the support groups, and, the grief groups, and, having friends like her around really meaning a lot.
Yeah.
People understand that. It's hard to get away from how difficult, going through cancer, I'm sure, but also being a caregiver is at the time.
Yeah.
And I'll say one word about the word caregiver. My understanding of that word is very different, because when Hector started, he went through about 8 years of multiple myeloma. Oh. And back and forth, I was his husband. We had a very strong, loving relationship. And when somebody came up to me at the time and said, "Well, you're a good caregiver," it hurt, because I'm thinking caregiver implies something outside of a relationship. Somebody who comes in.
Yeah.
My role was far, far beyond what I thought of as caregiving. It was something that was part of the love and part of the relationship. And,
yeah.
Since that time, I kind of understand it, but that word really hit a sore point for me when it was brought up.
Yeah, that hurts my heart a little bit to hear that, because you're right. It sounds like you weren't acknowledged in your role as a spouse.
That's right.
And so maybe there's a need to change that. I don't know. I don't know what the right, and I can completely understand how you would feel that way.
Amy, you mentioned
a hired person to come and take care of this.
Yeah. Amy, you mentioned that you were also caregiving. Did that ever enter into your mind? It's when somebody called me that.
Yeah.
That it hurt. But
yeah, for me?
Yes.
For me, with my mother-in-law, it was weird, because I, as a nurse taking care of her, it was hard to compartmentalize again, to separate my role as a nurse and as a nurse practitioner, and to actually see things happening, understanding the physiology, the pathophysiology, and why things were occurring, and seeing it happening in this very strong, stoic person, and then feeling like, no, this isn't this is my job. Yes. This is my mother-in-law, and I care for her, and it was really difficult. It's like everything I learned kind of went out the window, and it just what I needed, what she needed from me really was just the connection, just for us to hold her hand, to listen to her, to tell her we loved her. She didn't need me there like for a lot of the other things, because we could have a someone hired to help with the more professional things that I could think of as a caregiver or nurse. So that was hard, just going into that role of just being the daughter-in-law who loves her mother-in-law and wants to take care of her and help my husband through this time a grief. So yeah, and her cancer was particularly difficult in that it was esophageal and head and neck cancer. And so it was difficult for her to eat, swallow, talk. So there was a lot of silence and just moments of like looking at each other and trying to understand and connect and understand her maybe gestures and things that, and
Yeah.
I don't know.
I agree. Maybe we should come up with a different word.
Right?
We'll talk about it.
Well, let's think on that, because I think for right now our time is kind of up. I think we could talk for hours about experiences as to be determined word to substitute caregiver. But yeah, I think this is wonderful. Thank you all for sharing, and especially in this month of November. Any men out there or anyone, we all have men in our lives that need to have annual physicals, wellness checkups. They need to have their prostate levels checked. They need to do self-examinations on their genitals, on their organs, on their testicles. These are things that we should be teaching our men to do from a young age. So opening up the conversation and kind of removing some of the taboo to all of this. Yo, bro.
Yes.
You also need to take care of you. So thank you again for joining us today. And anything you'd like to leave this broadcast with before we end?
Well, when you're a caregiver for someone that you really love, you don't feel that you're a caregiver. You're doing it out of love for that particular individual.
Okay. Yes.
And just a little plug for the Yo Bro experience. I've been to all of them. Herb's been to them too. It's a great sharing experience, but it's also very enjoyable. Guy talk, and at one of them, they have this golf thing on the screen, and so it's just a good get together in many ways. So thanks.
Yeah.
Thanks to the stories that created it.
We have a comment from Dr. Sonia Fung. She says maybe a word that we could say instead of caregiver is love giver.
There you go. Good.
Right. That's it. Perfect. Thank you, Dr. Fung, wherever you are.
All right, everyone. Well, thank you again for joining. If you'd like this program, continue to seek more information on our shayswarriors.org website. There you can find the different dates of all our calendar with all of our events, and we're here for you. We look forward to having more talks like this one.
Thank you, Amy and Sonia and Shay for organizing this. This was a good experience.
Thank you so much.
Bye.
Okay.
Bye.
Bye.